So today's question has to do with chin liposuction. We're going to bring up the patient's photos, and the patient provided us with three photos, but she asked the specific question. Hey, I had chin lipo and now see this line underneath my chin. What happened? Well, maybe nothing happened. Maybe there was a little bit of lack of thought and planning, but the question is what can be done? So sometimes when we liposuction, we need to think about not how much fat we remove, but how much fat we preserve and where we take that fat. In the lower chin area, neck area, we have a couple of muscles here. We have the platysma muscle and we have the digastric muscles. And I think we can really see her digastric muscles, those two bands. And that may be covered by platysma, which is above that or superficial, closer to the skin. But what I really think happened is that we had, in this case, too much removal of fat between those muscles. And it actually did not create a soft contour. It really kind of skeletonized the patient. So, what can one do? Depending on where, she is in her healing process, we obviously have to wait for the amount of tissue response. They got to heal, swelling has to come down, tissues have to become soft, and the contour has to become stable, whatever that result may be. Once that's done, we can do a couple of things, but not many. What we can really do is probably focus on fat grafting and adding a little bit of fat to that area. It sounds crazy and counterintuitive, but that's probably the thing that we can do. Some people may entertain contouring these muscles down, but again, that's a big leap in my opinion. The thing is, we need to be thoughtful prior to any type of intervention in the chin or anywhere on the body. In this case, we want to make sure that we leave a reasonable layer of fat between those muscles and a slight layer covering them that gives us a nice, soft, but reduced contour. So, here, diagnosis before any treatment is a key, and diagnosis now after you have a problem is a key because we don't want to create any new problems. So that's how I approach this. I always tell these patients that I'm giving advice on these forums that, hey, this is just my opinion and recommendation. This always requires a formal evaluation by a board certified plastic surgeon that include a consultation, physical examination, and giving you all the pros and cons of each treatment alternative. Again, thanks for watching. I hope you enjoyed our first video for real questions, real answers, and real surgical thinking. Follow me here at on the social media platforms at ESJ Aesthetics, where you get honest plastic surgery education. Till next time.